of all heart disease, stroke, and type 2 diabetes can be prevented because they're diet related, and we have control over our diets most of the time. Now, we have known now for decades that the actual causes of premature death in the United States are not the diseases on the death certificates. No. It's the factors that cause those diseases. I had a lady today, I had a lady yesterday, and a lady the day before that had their thyroids cut out because the doctor said that they was being attacked by antibodies. So I had to cut the thyroids out, throw them down surgical chutes. One lady is very hefty. She's over 500 pounds, and she's in tears because her thyroid's missing. The thyroid whacked it out, threw it down a surgical chute, and gave the excuse as being attacked by antibodies. Never asking where the antibodies come from, why they're so prolific in the body, eating up everything soft, including the thyroid. So, they never get to the point. In fact, they're busy paying for their yachts in Florida, so, of course, they don't care what the cause is. They are operating on the end results, you see. Scientific literature from the mid-1980s on shows that eating saturated fat, which is mainly found in animal products like meat, dairy, and eggs, is more strongly associated with death than smoking cigarettes. So I mentioned that, I think, last week. That a multiple, think about it. If you took your family to a neighborhood cookout and the dad next door offered your child a cigarette and a light, how would you react? Well, yet we accept with thanks that beef burger from the same dad and thank him for it. What's the difference whether you die of a cigarette or a burger? The smell and the taste, the social assumptions, the habits, the lack of knowledge. That's the difference. That's the only difference between the two. So we want to talk about this today a little bit more. Most people would consider their doctors a reliable source of nutritional advice. But the truth is, it's like drawing the curtain back on the Wizard of Oz. Only about 25% of accredited medical schools in the United States require their students to take a single dedicated course in nutrition in 2009. The National Academy of Medicine recommended back in the 1980s that the medical schools provide a minimum of 25 hours of nutrition instruction. 30 years later, the few schools offering courses on diet and disease provide less than 24 hours of nutritional instruction on the average. Most of them getting only about 11 to 20 hours out of the thousands of hours they spend in medical school. So the major cause of death, you see, is not addressed. Nutrition education is just not mentioned much at all, you see. And that's because they don't give it much, there's different factors accumulating here to keep that from happening. That the Medical Society asserts in its 36 pages of requirements for doctors of internal medicine that, quote, internal medicine is a discipline encompassing the study and practice of health promotion, disease prevention, unquote. And yet again, there is not a single nutrition-related requirement included in what they require doctors. So we're compartmentalized as physicians. The heart doctor treats the heart, the stomach doctor treats the stomach, and the knee doctor treats the knee, and the diabetes doctor, treats dysfunction of the pancreas as if it was just a separate thing. No one's looking at the whole person. They don't ask what the patient is eating or how he's living. And sometimes the patient isn't even in the picture. The doctor they don't even use his name. They say, well, they don't say Mr. Smith in room 201. They say the colon cancer in 201. You see when they're talking to each other. So the laser focus is on the disease, not on how the disease got there. So in an intrepid attempt to explain or to remedy the situation, Dr. John McDougall, good man, a pioneer in preventing chronic disease with nutrition, drafted a California Senate bill, Senate Bill 380, in which he introduced that in February of 2011. It was Senate Bill 380. It would require physicians and surgeons to complete in 5 years, by December 31st of 2016, more than 5 years away from the bill when it was introduced, a mandatory continuing education course in the subject of nutrition and lifestyle behavior for the treatment of chronic disease. All doctors licensed before January the 1st, 2012 would have 4 years in which to complete this course. To take just a few hours of nutrition instruction. Well, Dr. McDougall testified before the California Senate Committee. The majority of diseases in this country are dietary related, and yet physicians who have been trained for 7+ years know virtually nothing about human nutrition. That is a travesty for the patient. It's insulting to the doctor. So, Dr. McDougall's bill originally stipulated 12 continuing education credit hours after 4 years towards nutrition education. And that number was quickly dropped to 7